Hello, everyone, and welcome to this webinar of the Canadian Association on Gerontology. I'm Laurie Weeks. I'm a professor at Dalhousie University and the Vice President of the Canadian Association on Gerontology. We just wanted to make sure first that you're all aware of our upcoming conference in October, hopefully in person in Regina. And the abstracts are due on April 15th. So please make sure that you get your abstracts submitted and plan to attend the conference in October. So today we're very pleased to have Dr. Lillian Hung provide the webinar for us today. She is a Canada Research Chair in Senior Care and the founder of and head of the IDEA Lab, which focuses on innovation in dementia and aging. Her research examines how technology and the environment impact care experiences of persons with dementia. She has expertise in patient-oriented research and knowledge translation. Dr. Hung is committed to facilitating connectivity between academia and practice, working collaboratively with interprofessional practitioners to find practical solutions to address pressing problems in care settings. So today, Dr. Hung will present her work about applying a collaborative action research methodology to conduct a telepresence robot project in long-term care. Thank you very much, Dr. Hung, for joining us today, and we look forward to learning more about your work. Oh, and I should remind everyone, if you have questions or comments during Dr. Hung's presentation, please post them in the chat room feature that should be at the bottom of your screen. And Dr. Hung would like, if there's any pertinent questions during our presentation, I can bring those to her attention to address. And then if we have time at the end of the presentation, we can have some discussion then, and you'll be able to use your microphone at that time, or you can just post questions or comments at that time in the chat room as well. So thank you very much, Dr. Hung, for joining us.
All right, thank you. And thank you so much for people come spend time and take the time to come to take a look at this the work that I do. And I know some of the audience that I work with. I know Jim is here, so there might be at the point of the time that I would like to invite Jim, maybe speak a little bit about his experience. So I want to talk about collaborative action research that we work together, and Jim is a co-lead of this project. And let me see, I could share my screen, and I'm going to start with the slideshow, and let me see if you are able to see it. And I'm going to go. Give me, Laurie, it's my slide, okay?
Yes, it looks great.
All right, so so today I'm going to talk about how do we work with patient partners and family partners. When I say patient and family partners, like these are people with lived experience. So they're not necessarily patients in the care setting. I use the term patient partner just because like funding agency with CIHL, and those are the language that we use. And for people who are here, like for Jim, and you need to pardon me, and he understands that I really mean like people with lived experience, yeah. So, and we work closely with a lot of frontline staff in long-term care, and I'll show some of the stories that how we did this work together in using an example of the telepresence robot. So I will start with talking about a little bit about the philosophical underpinnings about collaborative action research. And then I will speak a little bit about the challenges, as we all can understand that it's been really tough for the last 2 years for everyone living, in the pandemic environment with public health restrictions. And it was particularly hard for people living in long-term care. And it was also hard for researchers to do research in that setting as well. So we'll talk a little bit about those challenges and how we did the work in creative ways and continue to try to engage people despite all of these challenges. And we'll share some of the stories and lessons learned. So let's start with our collaborative action research. Collaborative action research we call CAR. It's not really that kind of car that we drive. It's a type of action research. So under the action research umbrella, you can see, action means that the research really focuses on taking action. It's not just about, lifting up the rock to see, there's a lot of problem. Okay, then what? right? So action research is really focusing on, yes, we want to understand the problem, but let's also work together. So the collaborative, it's about working together and trying to identify some actions, practical actions that we can do with the community, with the people that in that particular setting for change. So if we can see that here, let me move this part, and the definition here from Colin and Brendan Miller, and they talked about the term collaborations really is the key word in terms of this particular type of action research. The collaboration denotes a more active role for people in social and professional change processes than a passive notion of participations. So that kind of make the collaborative action research distinct from maybe from participatory action research or other type of action research. So you can see action research is kind of like an umbrella term, and collaborative action research is one of them. So so essentially what it means is like having that active partnership with the people that will be affected by this type of research, and we work together for change. So another really key philosophical underpinning for collaborative action research is relational agency. So we choose people who are working in this paradigm that we choose to believe there's the relational agency, meaning that by working together, by we bringing people together, then we have agency to make change. So there's an emphasis on the social and relational aspects when we do the research together. We pay particular attention to everyday ethics and how do we work with the stakeholders, like those in our researchers are the frontline staff and leadership in the healthcare organizations, and our patient and family partners. Those are the people with lived experience. And also, in the lab that we have like trainees and researchers and collaborators and nonprofit organizations like Alzheimer's Society, that they're part of the project. Like, how do we work together? And so the second point here, it's about like bringing people together with really different backgrounds, because like people, patient and family partners of the residents or families in the care home, they might have like particular interests in terms of doing research, and frontline staff may have a different kind of interests and experiences. And researchers also have our particular agenda. We want to study the problem. We want to see what can be done to improve that situations. And academic publications and all those things are also important for researchers as well. So to be able to have that like share understanding, knowing each partners and what their interests are, and how we can find shared purpose and take actions to do to make change. So that's one thing that's really important about doing this particular of research is we believe people can learn from each other and learn with each other. So it's through these implementation of new actions. In our case, it's about using robots, and we think that there's a complementary knowledge and skills. So that power dynamic, it's not the academic researchers know the best, or people who have like knowledge about methodologies that they know better. It's really about trying to level that that equal partnerships, and really choose to believe people with lived experience that they are expert of the knowledge about about that problem that we are trying to solve. And so it's just really about respect and relationships, I guess. Yeah. So our project today, I'm going to talk about, it's we use this CAR approach to work with stakeholders. Again, our stakeholders are the frontline staff, and they are nurses, and they are healthcare workers, and they are recreation staff, housekeepers, anyone who works in the frontline in long-term care home, and patients in long-term care home, they're residents and people with lived experience, and also have families, their family partners, and also leaders. Operation leaders are also very important. Like when we try to look at infection control, like those regional infection control officers are also, they play a really significant role in terms of the work that we do. It's really about bringing people with diverse interests and see how we could work together towards a shared goal, which is for better care for our people living in long-term care. So you can see there's two pictures here that I want to introduce. Like Jim is here with us, Dr. Jim, and he it's the co-lead of this project. And during the pandemic, he has been using the robot to talk to the residents in the long-term care home because he won't be allowed to go into the long-term care with the public health restriction, but he was able to talk to the residents through the robot. And he was also talking to the staff and having like interviews and good conversation with the staff as well. So that it was through the robot then that made it possible. So so in order to explain, give you highlights about the research, I'm gonna maybe show you a video clips that was recently in the news, and that give you kind of a brief explanations, overview of the project. Let me see, I could go find that. And I'm gonna share again. I think here. Let's hope it works.
Lillian, I don't hear the volume.
Okay, let's try it again.
Are you running it from when we practiced the external website versus from within your slides? I think you have to switch to the browser.
Oh, that's right. Thank you.
Yeah.
Yeah, so it's Safari here. Okay, let's try it one more time. That's right. Okay, let's see.
Jim?
Taking seniors' care to a whole new frontier. Lillian Hung and Jim Mann are the co-leads of a study that is putting technology front and center in long-term care homes. These robots are being used as a communication tool for residents. The benefits, easy to see.
I was talking to somebody in the lounge and another one in the dining room. Their reaction was as if I was standing there.
During the height of the pandemic, residents in long-term care were all but cut off from the outside world. The obvious solution was tablets. And while that partially solved communication issues, it created a whole new set of problems for residents with dementia or mobility issues. Staff members often had to hold the device. It was labor-intensive and inefficient.
During the pandemic, we hear families that they get 10 minutes a week. With technology, they couldn't connect, and they don't even get that 10 minutes. Sometimes when they were able to log on, and the iPad was not facing the residents.
The robot solved that problem. Family members can book a time slot and then, using an app, drive the robot to the bedside of their loved one. When they're done, the robot goes back to its charging station. In a long-term care setting, this kind of technology is ideal, easy to use, and accessible. But think of the possibilities here. They're endless.
Staff being pulled in so many different directions. Here's a need, or here's a solution to the need.
The robots cost about twice that of a high-end iPad, and there are some hurdles to this tech being used on a large scale. Infection control and privacy issues needed to be sorted out, the lab working closely with staff to deal with their concerns. But the residents in the 4 care homes where these robots live love them.
When we use the robot, we can see, people, their face light up, their eyes open, big smile, a lot of joy to be able to see family.
The study will continue for 3 years, but early data shows this technology can make a real difference in the lives of seniors. Aaron MacArthur, Global News.
Let me see, I'm gonna go back to the slides.
Heat pumps are electric, save energy, and help reduce your carbon footprint. And they also provide air conditioning, so you can stay cool in the summer and cozy in the winter.
Okay, I close that. All right, so you can see that kind of give you a bit of overview of why we did the research, because it was a pressing demand in long-term care. There's a need for family connections with the residents in long-term care, and it was the social isolation and the loneliness problems that we want to address. So in collaborative action research, often when we do research, we're trying to address a problem, not coming from what the researcher's interest is, more about what the community needs. So that's a really important piece. And you can see that when we do this work, we work closely with the people, the stakeholders in the community that would, in our case, the frontline staff and our people with lived experience. And Jim, it's the co-lead of this project. So we have this collaborative relationship that he is the co-lead and he's equal with me that as a researcher and a person with lived experience to do this work together. And here, this is a picture of Jim that he was like at one of the long-term care talking to one of the residents who gave him a story about his experience during the pandemic that he was living in that particular care home here in Vancouver. And another picture of Jim that he was talking to the staff about their work. And during the pandemic, the staff were so excited to see him. And after, I remember that after that day that he spent some time over that at that site, and the staff, they all asked me if they could have they were involved in picture takings, and they were asking like, can I have a picture of having Jim on the robot? So they felt really proud to be part of the work as well. So in the research that I mentioned about the stakeholders, that we have staff champions and at each of the site, and we also have people with lived experience and community partners. Our community partners at Alzheimer's Society, and now we also have researchers that coming from all different disciplines, and also we have trainees in our lab that they're coming from kinesiology, healthcare leadership, people in beyond healthcare. Charlie's coming from engineering, and we could also see Mario here is that another person with lived experience. We have a group of people with lived experience working with us in this project, and we also, I'll show you later in the pictures of other people with lived experience as well. Oh, it's here, and you can see we have Lily here, who is a family partner. We have like Vancouver Coastal Health. They are also our partner that in the project. We have Lynn Jackson, a person with lived experience, and we have Annette. So that's a group of people that with trainees, universally, and so it's really fun to have people coming from different backgrounds, and so we are able to bring I talked about in the beginning about complementary knowledge and skills, because we all bring our expertise because of our backgrounds to enrich the research. Yeah. So I talk a little bit about how beneficial about bringing people together to contribute to research, and it's also challenging to do this kind of work because we try to build relationship and we try to use that relational piece to do our research. But in order to do that, without the possibility to do in-person work, so that made it really, really hard. So the virtual environment, like we do a lot of Zoom calls, and the Zoom call can be helpful because it reduces the travel time, and makes it possible for people to work with us like with very busy schedules. But it also can be very challenging. Don't forget that our people with lived experience, they're older people, and some of them are living with dementia. So it means that we got to make sure that they have the technology and they feel confident to use the technology. So in the beginning of the COVID pandemic, like we have sent devices to some of our patient and family partners, and we also provide a university student to help them to use the technology as well by having these ongoing support for our partners, which is really key to be able to overcome these challenges. And I talk about engaging team members. Like there were lots of times that when our sites have outbreaks and we're not allowed to go into the site as well. So to try to pick up the phone and try to call them and try to book time and emails, and we try to any ways that we can connect with them. And whenever there's time that when there's implementing a public health policy that they are very busy, and we have to do a lot of stop and go approach. Like we have to stop, respecting they are addressing some emergency, maybe with staffing and whatever that is, and we just have to stop. And then whenever there's a chance, then we start again. We pick up the phone and how are you doing this week? Is it possible that we can have a 15 minutes of your time or 20 minutes so we can talk over the phone and see how things are going? What can we do to support you? That kind of thing. And that's also about engaging the site and motivate people to use the robot, whenever there's a chance. And I will tell you a little bit about their stories about their particular time, that how the robot actually helped to contribute to their work, and then using those stories and to help them to inspire the staff to use the robot more. So I mentioned about here's a picture of the newsletter that we use that for try to communicate with across site and share some of the successful story and the things that we have done. And we spend a lot of time trying to build team, and the champions at each of the site, long-term care site, they are part of the team. So we're all equal partners. We stakeholders are part of the team in order to achieve a shared goal, which is to see how the technology can use to support the staff to provide better care. So a regular check-in, spending time and trying to talk to people and sending a text message, having a short phone call. These are really, really key in the work that we do. Let me see if I could play. We also use creative ways. We use a lot of medias like Twitter, and we use videos on YouTube and whatever the way, newsletter, like you just saw the TV news, and whatever that seem to fit people's needs. And staff seem to like, a lot of staff like videos, and a lot of public kind of like video instead of reading, academic journals. So we use quite a bit of video methods in our work as well. I'm going to show you this one that we did it kind of earlier.
Okay. Hi.
Come to meet robot devil.
Okay.
Yeah, so you can see that with that video, then you can see like Jim, by using these video methods that will allow us to, convey our message to the public, and also, to really showcase how Jim and our patient partners, and how we are can have them actively involved in the research rather than being consulted, maybe at the back seat, and this is very different in terms of doing CAR, collaborative action research. So that active partnership, it's really a style of the way that we do our research. And here that you can see that Jeff is one of our staff champion. Jeff, it's a rehab staff that in Vancouver General Hospital, and now he was involved in helping the residents to use the robots, and he said, I said yes to participate research because I believe that it makes life better for my patients and colleagues. And there are, in terms of trying to be creative to work with the staff, and there was time that during the pandemic, like I mentioned about the stop and go, the goal was there were times that when the cases were lower that we were able to go in, then we will go into the staff huddles and to take it that the staff huddle. Most of the places, the care setting will have like staff huddles on a daily basis. So when they finish the staff huddle, then we'll go in there for a few minutes and we'll show them how to use the robot, and that's how we provide staff training. And we also we made videos, and so that people could, using the video to go by like kind of the YouTube DIY, then you can learn how to use the robot by yourself. And here are some of our staff who kind of like the early adopters, and they embrace the robots and help us to introduce the robot to the other staff to help the family and residents to use it. And here it's a team at our other site, and we do, even though it's very difficult work during the pandemic, and we did have a lot of fun by having the staff to do the work together, and you can tell from the picture. And another challenge that we had was like when we were trying to understand how the robot were being used, and we heard from the concerns some of the staff, they were saying that the robot has that light. We kept the robot in the nursing stations, and when the staff see the light of the robot, and especially when they were working night shifts, and it made them feel uncomfortable having that lights on the robot. So some of the staff were also worrying about when the light is on the robot, does that mean the robot is recording us, or is it doing anything? And there's a bit of worry about, the camera, like filming when they're doing their work, but it's not. So when there's not a call, the robot is not, it's not filming anything. A practical solution came up was like, why don't we put a cover over the robot when the robot is not being used, when there's not a video call? So what we did was we put a call to the community. That was a poster that went on Twitter that we asked, like, well, we need some leaders to help us to put to make a cozy to cover the robot, because that will help to solve the problem that when the robot is not in use, then the light won't be bothering the staff. So when we put that Twitter call out, and we got a lot of response that people in the community were responding and say that, well, I could, I am a leader, I could do this for you. And you can see that we have all kinds of creative cozy that were made by the community members that they sent it to us. And here it's a couple examples. And here is another example. So the other day I went to the office, so the whole box of these cozy came over. This person actually, it's an older person that she's 86, and she said she's spending time at home and made these cozy for us, and because she saw the Twitter call that we made. So we were very excited. A photo about our team. You can see Charlie there. Charlie, it's you met him earlier in the other video. Charlie is our engineering student at UBC, and he works mostly at the technical part. That he worked closely with the industrial partner, the company who made a robot to customize, some of the things about the robot for our long-term care sites. And here in the middle that we have Joey. Joey is our project manager for this project, that she works closely with Jim and me and try to coordinate the work for the project. And we also have two educators here, that Marie and Kiran, that they are in the long-term care site. That was Christmas Day, I think. And the day before Christmas Day, it was Christmas Eve, that during that morning that we spent some time and doing some research work at that time. The work that we do, we insist to have fun. So it's because it's all about relationship and the relational aspect that we want to focus on. So whenever there's opportunity, we try to have some fun. And this is a pictures about during the Halloween that we use the robot to do trick or treat with the residents. And here it's oh, maybe we can see it. Let's see.
Hello.
Happy Halloween.
Happy Halloween. Happy New Year.
So that's Joey and Charlie, the UBC students, that they through the robot, they went through room to room to the residents to say to do trick or treat. And again, we have really diverse group, students from all disciplines, and Mario is featured here in the in these photographs, that he worked closely with us every step of the research. And the team, and there's other staff here at the site that we're working together. Some of the achievement that we have made, and we have done a survey that we have 181 staff that completed the survey to answer about what they think about using the robot at their workplace. And 75% of the staff said that in the survey, they said that yes, there are risks. They worry about the safety issues about the robot. A lot of people worry about the robot might be maybe environmental risk, and because they have a lot of colors in some of the rooms, and they also, some people worry about the robot would get in the way in front of the residents. So those are the safety risks mostly related to the robot will get in the way, or maybe it could become a weapon, if someone who lift it up and break it, that kind of things. And but like what I said, 75% of the staff think the benefit would outweigh the risk. And 80% of the staff are saying that they feel like robotics, something like this, will be the future of long-term care. We will have this kind of stuff in long-term care. And 76% of the staff is saying that they said they will feel confident to use the robots if they're provided training. And that's why we are doing this research and trying to work with them and see how we could support them to make them feel confident and to look at what might be some of the learning needs. As we know that in long-term care, a lot of our staff, like the bulk of the staff are the healthcare workers. So we really have to make sure, the training methods really like using like adult education theory and, and making sure it's something that it will meet their needs and not something that, just too much reading and no one's going to read it. Yeah. And we published a scoping video, and we have done a whole bunch of conference presentations last year. And we had a lot of media interest, and TV stations and newspapers came to wanted to have the stories about the robot, maybe because of the novelty. And we have, so by having these media coverage was also very helpful in terms of inspiring people to pay attention to the research. Yeah. And I want to share some of the stories that we had. So not long ago, a few weeks ago, that we had a person who was actively dying. He was very sick, and he was near his end of life. And we were able to provide a robot and put the robot in his room. So he had a single room and just by himself. And by having the robot in his room, and we give the link to the family. The family were able to share that the link to log into the robot anytime, and with any family members. So this family has relatives and friends, and in US, in Taiwan, and also here in Canada. So it's not that they were not able to visit. The daughter, they were granted compassionate visits. So the two daughters were able to visit, to come to the visit at the site, but the robot was more of it's not a replacement, but was a supplement. So the daughter they gave the link to the other family so that they were able to gather together, because the other family members were not able to come in to visit. So they were at the site, and the other family members were able to join in for like family meetings. And the person also have the person who's dying also have a lot of good friends in the US that they were not able to travel to Canada to see him, and they came through the robot to be able to spend time with him. And there was a granddaughter who was able to like play piano through the robot to spend time with him. And there was another daughter that was she's living in Taiwan, and when she come through the robot to visit him, and a physician happened to be in the room, and the family was able to have a conversation with the physicians as well. So the family was like calmed up, and they were feeling very grateful to be able to spend a lot more time with him, and also to make it possible for extended family to spend time with him. He died a week after, but he had a lot of time to spend with the family because of the technology that we were able to provide for them to use. So that is one of the recent story. And another site that we have like a lot of virtual visits by using for different reasons. There are families that they might be immunocompromised, and they are not able to take the vaccine, and those people were able to come through the robot, and because they were not allowed to visit, they were not vaccinated. And we also see that people are being creative about using the robot to do other things. I know one of the sites, and they use the robot to do a virtual tour, so people could come in to see the facility. And they also have volunteers that they could come through the robot to do program for the residents. So that made programs possible. And pet visit, then the little dog could come through the robot and allow the resident to see the pet. And I know they also have a new acupuncture program for the residents. And because, it's the family, we're not able to be there with the resident, like with the public health restrictions, but the family were able to be there, like through the robot, having that physical presence through the robot, even though they're not, able to go in there in person. So you can see the robot expanded the possibility for people to be there for their loved ones. Yeah. This is a typical way that how we go about doing this type of research. We often start with bringing, all the stakeholders, and you can see the offers here that we have patient and family partners. When I say patient and family partners, I mean people with lived experience, and we have clinicians, we have academic partners as well. Then we often start with like trying to look at the literature. We'll do a scoping review, and by having the people with lived experience to be involved in a scoping review really help them to understand like what has been done and how we would like to use, what kind of methods that we would like to do. So having them to help us to design the research and identify the priorities. So I think that's also what makes it a bit unique about the CAR, the collaborative action research, rather than having the researcher to design the research and just asking people to participate, right? And they provide inputs about the methods, and a lot of times that they will be involved in data collections and analysis. We always do team analysis together because each person, they have complementary skills and knowledge in terms of when we look at the video recordings, often, Mario has something to point out that we didn't see yet. And when we do knowledge translations, and we often have like Jim, Mario, and come out to to be the spokesperson. We also provide opportunity for the trainees to be in the news media as well, and we co-author publications. So it's a lot of fun working together. So here it's the publications that Mario is a co-author that we publish, and this is the actual scoping review that we have. Again, we have all our patient partners there, and this is a paper that was published earlier with Jim being the first author. And maybe we can ask Jim to talk a little bit about that in the discussion time. And a poster that we made together that, they really address, what we call the Ask Me framework. Ask Me, it's a practical tips that we want to provide for people that if they want to work closely with patient partner, they should try to be like step one, ask, start with A, avoid assumption. The S means support the person to do their best. And the K, knowledge needs to be put into action, not just the talk. And M, meet early and regularly, those regular meetings so that people have opportunity to participate and provide their input early, not being an afterthought in the end. And ethical sensitivity and responsibility. So it's the everyday ethics that we talk about, the relational aspect. Yeah. So here's Jim and I work. We spend time working in this coffee shop. This is the way that we work together. Another piece of paper that published with Charlene that we talked about, the technology, it's really an enabler for person-centered care that we think that would help with providing better care. The next coming plans for our work, we're gonna work with implementations. We have more robots coming, and we will continue to work closely with family and staff, and it's really important to keep that momentum to do the work that we would like to do together. And Joey puts up, she often have these wonderful graphs and to try to engage, like it's an active partnership that we work together, having people involved to do the work, and instead of just an afterthought or maybe a ticky box. So I'm going to stop here for a conversation, and I wonder that maybe we could start with maybe inviting Jim to speak maybe a little bit about his experience and working with us, and he co-lead this project with us. Is that all right, Jim, putting you on the spot?
Sure. Thanks, Lillian. This project is especially important, not only for COVID, but because families are becoming more mobile. And so there are so many benefits to allowing that family and friend connection, because there are papers written about people in long-term care. Residents are still, even though they're amongst a number of people, feel lonely and aren't not getting the socialization that they should be getting. So I see this as a very very important project. But the involvement of the different disciplines has been not only interesting, but really when it comes to the computers and the robots has become really such a positive, and so your practice of involving so many different, as I say, different disciplines has been such a benefit to the project. But I really, thinking back to one of the slides in your presentation, showed the resident and the robot that I was maneuvering around. And I think the one thing that we were hearing early on was the concern that people would be sort of, pull back because what is this black thing coming towards me, and being put off by just seeing a face. But in fact, the reaction from that gentleman and actually a couple of other gentlemen in the home was absolutely amazing to me, because they looked at me and talked to me and just treated me as if I was there from head to toe. And their reaction was, well, I was absolutely amazed by it. And that gentleman that was in the photo, he and I were laughing and having quite a lengthy conversation, and he watched me roll up, he watched me roll away, he watched me just from the neck up, but it was still as if I was there. So I guess I relate that for a number of reasons, but one of them is because we all have that preconceived notion before we go into situations or we start research, perhaps involving patient partners. And it really is so necessary to try to shelve those preconceived notions, because you will be really, really surprised, as I was in talking to the resident. So.
That's wonderful. Thank you, Jim.
Yeah.
So I wonder if, Laurie, do we have any questions?
Thank you so much, Lillian and Jim. It's great to have you both here and able to share this really interesting project, timely, important work. I neglected to mention earlier that Lillian is the most recent recipient of the Canadian Association on Gerontology New Investigator Award. So we often invite our award recipients to do these webinars. So I just wanted to mention that to everyone. Thank you. That was just lovely to learn more about the work that you're doing and the impact of that. So if anyone does have any questions or comments for Lillian and Jim, or Jim, you're welcome to use your microphone. We had you muted earlier, but you were able to unmute at this point, or you can certainly write any questions or comments in the chat room as well. So and I think you can turn your video camera on too if you wish. So did anyone have anything that you wanted to ask? Dr. Martin Matthews, I saw you turned on your camera. Did that mean you'd like to say something?
Well, I had planned to ask a question, not necessarily the first one, but I'm quite happy to jump in and do that then. Laurie, you said you should turn on your camera, so I'm
Sure.
compliant. But anyway, thank you sincerely to Lillian and to Jim for that presentation. It was really very, very interesting and stimulating. My question, so I didn't want to go first because my question is not actually about the robot. My question is actually about the people. And in the role I have now at the University of British Columbia, we have a unit called UBC Health, and the entire focus is on interprofessional education and training students to be part of the workforce of tomorrow in a team-based care, different professions coming together. So I was actually quite interested in that angle, but it wasn't something, Lillian, you were emphasizing. So I don't want to take away from your discussion specifically of dementia and the robots, but that's not easily done. And you referred to students from different professions. So if there's anything that you'd like to say, and then we can take it offline because we're colleagues at the same university. So that was really the linking across disciplines, staff, students, and that whole notion of a team, and then patients as partners as part of that team as well. So hard to do, but you did it. So interested in that.
I could say a little bit, and I'll invite Jim to add more because he has a lot of experience working with the student across disciplines. Yeah, so I really don't have a hard time to recruit. And I think we were lucky that we had an engineering student at Charlie. Charlie, he has started with creating a website for us. So having the website that opens up the opportunity. So people, for some reason, they find our website. And I think what's really important is what we've written on the website is our values. Every time when I see an email coming to like that they want to be part of our lab and how could I volunteer, how could I to be a research assistant, how could I join the work that you do, and how could I learn about working with them? There's a lot of interest about students wanting to work with clinicians and wanting to work with the industry. So it was our values that attracted them. Yeah, so it's that shared goal that we are here, that we work, we insist that we do patient-oriented research. We work with patient partners. When I do interviews, I always emphasize, so this is a different type of research. And if this is something that you like, and then you're welcome to join us, but it's very different. We work closely with our patient partner and frontline staff. And we say that all the time, relationship is our foundations. I think it's that attracted the people who wanted to come. And I don't know, I don't want to offend anyone, but we got a lot of email that people say that they have worked in the wet labs, doing traditional type of the lab and, mixing solutions, and they really want to try something different. And they came to us and just love it. Yeah. So Jim, over to you, because you work so closely with many of these students. Yeah.
I am encouraged by their attitude of wanting to be involved, because as you well know, I mean, I've heard it for years about the silos that people work in, that this is the area I'm in and this is the area that I'm working with. And it is tough breaking away from that, and perhaps the push by CIHR to have the patient partners to involve the lived experience voice has been an impetus for that. But I think there is hopefully a slightly better understanding that these different disciplines can bring the knowledge from their learnings, perhaps like Charlie in engineering, to this particular project. And he has been working, very involved in this project and has been dealing with the manufacturer over training and so on. And at the beginning, would somebody have said, oh, let's put a team together. Oh, let's get somebody from engineering. No, you wouldn't think that, but it is such for me, a beautiful illustration of the benefits of going beyond, in some ways, your comfort level and involving others. And so, you know, I'm going to say, you know, you could almost write a paper about it, just illustrating the benefits and how it happened and why it happened and the benefits that are derived.
Well, I actually think, Jim, there is a paper there because so often it's the process of how you connect. You know, you talk a lot about relations, Lillian, and relationships. So you're mostly talking about, of course, with the residents in the facility and with the staff, but there's also the building of relations if we want to think holistically and beyond the silos, which is how we typically train people. So, so thank you. And I can certainly follow up with either of you on elements of that, but very much
Love to do that.
Thank you.
Yeah, and as academic educators, that we want to see the growth in the students as well. So it's just beautiful to see how they wouldn't come together if it wasn't the research work that we did, and how they feel relationship, they support each other, they learn from each other and see the growth. Like engineering people, they're very good with the machinery and logical thinking, but they are a little bit timid in terms of like leading team meetings and stuff like that. And they learn from a nursing student, right? The nursing student learn the technical skills, like, so they learn from each other. It's beautiful, and see the friendship. It's especially during the pandemic time. Yeah.
Well, wonderful. What a great component of your really interesting work that you're doing, and really important piece. Thank you for that question. There was a question from Gloria Gutman in the chat room about, so you have this really wonderful form of technology. So can people access it? So is it available? Can it be purchased? Can it be rented? And I think you mentioned the cost was about twice what a tablet would cost. So about how much, would that be? So yeah, first, is it available?
Yeah, it is available. It's fully commercialized, and anyone could Google and buy it. And it's $4,000 US dollars. So
okay.
I think they have a shortage a little bit, like, which is understandable because of the computer chips. Yeah, but you can just Google double and you can buy them.
Mm-hmm. Great. Maybe you can send us some information about that, and we could share that with people too, about the name and where to order one. Okay, great, thank you. So another follow-up question about the technology itself. So it was really clear that when Jim was on it, like, he could talk to people wherever they were in their rooms. So what is the technology behind that? Is there apps, or is there a certain program? Like, it looks a lot like Zoom or something like that. So what is the technology that's really guiding the software component of that? And does that come already on the machine?
Yeah, it's what makes this the robot special. It's that it meets the needs of the users. It was zero effort for the receiver side, from the older person, because we that a lot of our older residents, they have the physical disability or cognitive impairments. So it's by having this robot that you don't actually have to do anything. Then the robot will come to them and will just turn on. So it's the family who is driving the robot remotely from home that control the robot. So they could use a tablet, or they could, like an iPad or Android tablets. They could use a computer, they could use a phone to drive it. It's the virtual reality that the robot camera takes from the site. And so that the family who remotely drive the robot could just look at the virtual realities created from the camera, and they would just click then the floor, and then the robot would just go to where it clicks it supposed to go. You tell the robot where to go, and it has all kinds of sensors. So if there's something in front of the robot, then it will know to navigate, to go around in order to go to the destination that you ask it to go. And it has, the sensor also allow the robot to self-park. So when it's finished with the car, then it will go back to the dock. It's kind of like those self-park car. So those are the essential features, and the audio is a lot better because it has amplifiers. So address some of the problems with those tablets. Yeah. And
So it already comes preloaded with the apps it needs to be able to do this.
yeah, yeah. I mean, when
Okay.
in that story that I talk about with that family with end of life care, and we didn't have time to provide any education or training for them. We just send them the link and they look at the link and they start to use it. It's pretty
Oh,
pretty user friendly.
great. So are there different versions of the robot? So one question is, like we saw, it was really great to see it in action. Are they all the same size? Like the question was really about the screen. Like, could you get a bigger monitor for them, or are they all the same?
So you can change the head of the robot. It only comes in one size, one head size. And this is the double suite, the third editions. Yeah. So I think you can buy cheaper version. The second edition you can buy from Amazon. They are a bit cheaper. The third edition has more advanced function like the virtual reality I talked about, make it a lot easier to drive. Yeah. So I hope I answered that question.
Yeah, yeah. Like, could the screen be bigger, for example? Or did you find the screen was big enough for your purposes?
Jim?
I think that the screen was certainly big enough. It was surprising how much you saw from my end. It was an excellent broad view, and as I said earlier, the individual just was convinced I was there. So I think it is deceiving, like thinking that it's a bit on the small side, but it really is a really it's a good size for what it's doing, for the job it's doing.
I think mainly because it's mobile, so it can come closer to the person. Yeah.
Right. Well, believe it or not, we are at our time. But thank you so much, Lillian and Jim, for that really wonderful presentation and sharing with us some of these innovations, and such a timely topic during the pandemic, but certainly tons of applications for after the pandemic as well. So thank you so much for that. And thank you all for participating in this great webinar. Of course, this is recorded and it will be available on the Canadian Association on Gerontology website. So let everybody know that it's there for you to view whenever you wish. So thank you all for connecting, and have a wonderful rest of the day.